One of the issues that comes up for me a lot is that I work with doctors in the San Francisco Bay Area. And I work with an office of breast surgeons, and I work with a gynecologist. So I work with two offices. Very, very interesting dichotomy between the two. The gynecologist, who nicknames herself the organic gynecologist, so she's very, very open to alternatives, loves all this stuff, and I'm doing a workshop there next week, and she's very happy to talk about, she's very happy to promote to her patients whatever it is I have to say. The breast surgeons that I work for are very, very, very allopathic. And they actually called me into their office last week and they said, why are you suggesting our clients get their C-reactive protein tested? I said, well, there's quite a connection between inflammation and cancer progression. And they said, there's no proof of that. So every time I get one of these studies like this, or this is hyperinsulinemia from the Journal of the National Cancer Institute, I now email it over to that doctor's office. But the other funny thing was they also said to me, why are you telling our patients to have their vitamin D levels checked? Yes, really. I said, well, because there's quite a relationship between vitamin D status and cancer risk and progression. They said, there's no clinical studies to support that. Now, what they mean by clinical trials, of course, is that it's a double-blinded, placebo-controlled trial where they actually kept everything else under control except for the administration of vitamin D. Well, they may be right. My response to that is when there's about 10,000 observational studies that show that there's smoke, then I think there's probably a fire there. So it's very interesting, though, working in the allopathic land, I call it, and being called to, I guess there's the word is, defend some of these results that are just out there for all of us to see. And the very people who are talking to their patients every single day are saying, in some cases, certainly not in all, in some cases they're saying, well, I can't recommend that in good faith to my patients because the clinical trials are not in. So it's very interesting.